Retinal inflammatory disorders is basically a group of diseases which can affect the vision of an individual eventually. Retina, as we've already defined it as a neuropigmentary layer or the end organ for the vision in an individual. So you should know that it's basically a neurosensory pigmented layer which is responsible for relaying messages towards the visual cortex. That is the basic definition which we give to the retina. There are the basic three protective layers, or even they have the other functions towards the eyeball, which mainly are the sclera. We have choroid, and thirdly and lastly we have the retina. So retina is the innermost layer in the eyeball, at the back of the eyeball, and it is responsible for the relaying the messages towards the visual cortex, and the final interpretation of the messages takes place at the visual cortex. So that is the main function that the retina is performing. When we look at the anatomical structure of the retina, we should know that we have the peripheral retina and then we have the posterior pole of the retina. So these are the terminologies that we're going to use on and off when we are going to relate to the inflammatory conditions of the retina. Inspecting the retina is again very important when we have a patient of acute vision loss, and we are just suspecting in a particular patient that this particular patient is suffering from some sort of a disease that is involving the retina of the individual. One should know that we're going to perform ophthalmoscopy or fundoscopy in this particular individual. This is how the retina looks like when you look at it through an ophthalmoscope or a fundoscope. You're going to see the important structures that are involved over there. You're going to focus on the optic disc, obviously, and you're going to look for any abnormalities in the margins of the optic disc. These are again very particular for different diseases out here. When we are discussing retinitis, we're going to focus on the waxy appearance of the optic disc. That would be the highlight over here. If there is any differences in the physiological cupping of the optic disc, that would be also noted down over here. So that is the mainstay, that we're going to just look at the posterior pole of the retina and find out any pathological features that are present over there. First of all, you're going to go in a very systemic manner when you're going to inspect or observe the retinal features. First of all, you're going to look at the optic disc over here, and then you're going to focus on the macula. Macula is somewhat over here in this particular diagram. As you can see, this pallor over here is quite inflamed, and it's not quite a normal macular shadow as we see in a normal eye. There should be a comparative study, there should be a comparison with the normal eye whenever we are focusing or whenever we are restricting our knowledge, that we are just focusing on any abnormalities in the retina of the affected eye in which the patient is complaining that he or she has the loss of vision. So the comparison should be always there, and we should know what a normal macula should look like and what a normal optic disc should look like. So first of all, the optic disc comes, and then you go on to observe the macula of the individual. As we all know, macula is responsible for the central vision of the individual. It is lacking the rods, and it's just having the cones in them. So the rods and the cones, as we should have the previous knowledge towards this histopathological photoreceptors of the retina. Rods and the cones are the photoreceptor cells that are responsible for the accommodation to the dim light, then the central vision, and the most clearer vision occurs at the fovea centralis of macula. So if any of these regions is affected, it is going to directly affect the vision of that particular individual. So this is going to be the manner. Once you have observed the optic disc of the individual, you have moved out to the macula of the individual. Now you're going to focus on the vascular structures. Again, it's very important just to accentuate the factors that if there's any abnormality in the vasculature of the retina, it's again very important. Are the vessels accentuated? Are there any tortuosities noted down over here? The vessels are quite normal in this ophthalmoscopic finding. They are quite normal. There is no tortuosity seen, and there is no cattle trucking phenomena, no cotton wool spots that are basically responsible after the hemorrhages that occur at the vascular structures. So these are the findings that you're going to look for when you are looking at the retina of an individual. The background knowledge, again, I would like to emphasize, is very important. You should know what you're looking at, or you should know what you're looking for, the pathologies you should know. Retinitis is the diagnosis over here, and how is retinitis classified, again, is very important. We can classify retinitis on the basis of the anatomical structures that are involved in a particular patient. Either it can be a chorioretinitis, which is basically involving the retina as well as the choroidal plexus of that particular individual. Secondly, we have the neuroretinitis, in which the retina as well as the optic nerve is involved. The optic disc is also involved in this particular case. So we say that this particular case is of the neuroretinitis. And then finally, we have the vascular retinitis at our hands. Vascular retinitis is when you find abnormalities in the vessels or the vasculature of the retina. Now, there are the multiple factors that can cause the vascular retinitis, and it can be the systemic diseases, for example, sarcoidosis, or all of the other toxoplasmosis, Behçet's syndrome. These are some of the diseases which cause the vascular retinitis in an individual. And then we have the specific reasons for the causation of the vasculitis in a particular patient. On the other hand, we classify retinitis on the basis of the causative factors or on the basis of the etiology. When we classify it on the basis of etiology, it is basically grouped into these two major chunks. On one hand, we have the non-specific retinitis, and on the other hand, we have the specific retinitis. So the specific retinitis is basically when you know the causative agents. It can be the bacterial retinitis, or it can be the viral retinitis, which is caused by the herpes simplex virus, herpes zoster virus, human papilloma viruses. All of these are involved in the viral causation of the retinitis in an individual. On the other hand, we have the mycotic retinitis, rickettsial, or even the parasitic sorts of the retinitis in the individual. So these are the categories of the specific retinitis in which we know the causative agents and in which basically we can relate towards the causative agents. On the other hand, we have the non-specific kind of retinitis in the individuals. When we say the non-specific kind of retinitis, it's basically caused due to idiopathic factors in which the factors that are causing the retinitis in the individual are not well known. It can be a congenital retinitis. We can further subdivide this non-specific variety into an acute phase of retinitis, which is of a very short duration. And on the other hand, we have the subacute variety, which is rather of a chronic kind. The stages or the clinical duration is rather of a chronic kind. We have the particular Roth spots that are quite visible. As you can see, these are the pigmentary layers, and these are sometimes quite visible in retinitis, and that is how you indicate them as to be this mottled appearance, is basically indicating that this is a condition which is also known as Roth's retinitis in an individual. Then on the other hand, we have the acute purulent retinitis over here. So it can be an acute stage of retinitis, as I've already mentioned, and this acute stage can sometimes become quite pyogenic, and pyemia is present pus is present at the retina. It's an advanced stage of the retinitis, as it can be seen over here in this particular ophthalmoscopic finding, that there is a lot of pus, there are a lot of hemorrhagic findings seen on the ophthalmoscopy or seen on the fundoscopy over here. One should know, if it is left untreated, it can be quite complicated. It can end up in the endophthalmitis, or it can be even complicated to be involving the panophthalmitis, which basically means the whole eyeball is sometimes involved in this infectious or in this inflammatory process that is occurring. Then we have the subacute retinitis of Roth, and we already discussed that these will be the pigmentary changes that are occurring, and these are known as the Roth spots over here. The clinical duration over here would be quite subacute, and it would be rather in a chronic phase that this condition is occurring. The condition, the causative factors are quite not known. The vision is affected. Tunnel vision is usually reported by the patient, and even you can find these Roth's kind of a retinitis in patients who are suffering from the autoimmune disorders, who are basically suffering from the HIV, that is the human immune deficiency virus, and the immunity is lower down, and they subsequently find themselves in this condition, which is known as the subacute retinitis of Roth. So knowing the causative factors, knowing the sign and symptoms or the clinical features towards this condition of Roth's retinitis is quite particular over here. And then we have the specific retinitis. The specific retinitis can be caused, as we've already mentioned, the viral causes can be one of the Cytomegalovirus retinitis, one of the examples of the viral retinitis over here. The findings, again, we have a mottled appearance of the macula over here. And as you can see over here, that the optic disc is also involved, and there are some of the hemorrhagic structures, as you can note down over here in this particular kind of retinitis. And then finally, we have the bacterial retinitis. So distinguishing between the ophthalmological appearance on the ophthalmoscopy, when you perform the fundoscopy in these patients, you should know what are the particular findings. As you can see, there is a lot of pyemia over here noted down in the bacterial kind of retinitis. The mottled appearance is quite significant in cases of bacterial retinitis when we compare it with the viral retinitis. There are areas of necrosis and gangrenous areas. They are noted down on the ophthalmoscopy whenever the causative factors are bacterial in their origin. And after that, we have the mycotic, and we have the other varieties of basically retinitis over here that you should know, in which you should know how to distinguish between these different sorts of etiologies of retinitis and their causative agents. Their clinical features out there are going to be quite similar as well. Now we have another condition which is known as retinitis pigmentosa over here. Now, retinitis pigmentosa is, again, as I would like to emphasize, it's not an infectious condition, but it is an inflammatory condition. Now, basically, you have to distinguish between these factors, that infectious is quite different from the word inflammatory. The infectious state is subdued along with the inflammatory condition. There are going to be the inflammatory signs, but sometimes inflammations are idiopathic. There are no known etiological factors. It's basically an idiopathic etiological factors that are regarded to as the inflammatory conditions. When we say it is the retinitis pigmentosa, it is basically a rare genetic inflammatory disorder of the retina in which there is a cell loss, and that is associated with the loss of cells in the retina, as well as there is a mottled appearance in the retina that is quite visible on ophthalmoscopy. Now, there is one very interesting fact over here. There is, you can remember the clinical features by an ophthalmological triad over here. This triad basically consists of a range of features out here. we should know how to know the normal anatomy of the eye and how we can basically compare it to the anatomy of an eye which is suffering from retinitis pigmentosa over here. As you can see, there is a cornea and we have the fovea over here. Macula is the area of the retina that is responsible for the central vision in an individual. The most clearer vision, it occurs at the fovea centralis, which is the most central part of the macula over here. So if there is any abnormality, and this portion is basically known as the posterior pole of the retina, in which we're going to find out the different abnormalities that are related to retinitis pigmentosa over here. So if there are any abnormalities, as you can compare it with the eye which is suffering from retinitis pigmentosa, the mottled appearance is quite visible over here. The neovascularization is quite visible over here. And what you cannot see, which is again one of the constituents of the ophthalmological triad that we were talking about, is the waxy appearance of the optic disc, which is not quite visible in this diagram. But these are the three major findings in the retinitis pigmentosa, or the patient who is suffering from such a condition. You will find these findings in this particular state of retinitis pigmentosa. These are the retina pigment deposits. This mottled appearance is very characteristic in patients of retinitis pigmentosa over here. So moving on to the pathogenesis, or moving on to the etiological factors, the causative factors, the whole course of actions that is ending up in the retinitis pigmentosa, that will be discussed over here. It is basically an inherited mutation of rhodopsin gene. So sometimes these are the just the opsin genes, and sometimes we have the rhodopsin genes, and we have a sporadic mutation of the rhodopsin gene over here. The mode of inheritance may be autosomal dominant, autosomal recessive, or sometimes X-linked in these individuals. And there is an abnormal photoreceptor protein production. Over here, I would like to emphasize that the photoreceptors that we're talking about are the rods and the cones. The rods are responsible for the dim light adjustments or the accommodation phenomena, how the dim lights are perceived. This is very important. The rods play a pivotal role in that. And the cones are responsible for the most central vision and the most clearer vision. So the abnormal photoreceptor protein production is one of the steps over here that is going to result in the retinitis pigmentosa in these individuals. Once the retinitis pigmentosa has manifested in these individuals, there are going to be the particular ocular manifestations that are seen in this particular patient. You're going to look for the mild arteriolar narrowing, as we were talking about it, and this mild arteriolar narrowing is furthermore going to result in the mild peripheral retinal pigment epithelium atrophy. Now, the pigment epithelium atrophy, when we regard it, it is basically resulting in the waxy pallor of the optic disc, which we were talking about. This atrophy is the cause for the waxy appearance of the margins of the optic disc. We have a tessellated fundus appearance over here, and that is basically the accentuation of the blood vascularization that is noted down in these individuals. There are mild peripheral, intraretinal, perivascular, bony spicule pigmentary changes are going to be noted down. This bony spicule pigmentary changes are basically giving out the mottled appearance or the pigmentary spots that are quite significant in cases of retinitis pigmentosa. On one hand, we can have a mild arteriolar narrowing phenomena, and on the other hand, the patient can be suffering from severe arteriolar narrowing in a lot of cases. There are multiple factors for this severe arterial narrowing. Sometimes retinitis pigmentosa is an isolated condition, but in a lot of cases, it is associated with a lot of syndromes. For example, Usher syndrome, Kern syndrome, Behçet syndrome. We have Refsum's disease. and we have toxoplasmosis. So these are the range of disorders. We have multiple other disorders as well in this list, or the group of disorders, which are sometimes presenting as a syndrome. In most of the cases, retinitis pigmentosa doesn't occur alone in a lot of patients. It's usually a combination in most of the patients. So whenever there is a syndromic person in which there is some other pathology as well, then the person may be suffering from this severe kind of the arteriolar narrowing. That is going to result in the waxy pallor of the optic disc of the individual. The night vision is going to be decreased in these individuals. These are the particular clinical features that the patient would be reporting to you. He or she would report a decrease in the night vision or a decrease in the visual fields. There is going to be the increase in the severity as the narrowing of the vessels furthermore goes on. So these will be the particular findings. Then moreover, the patient can give you a history of photophobia or photopsia. Floaters can be found out by these patients due to the hemorrhages that are occurring at the posterior chamber of the eye. So these are the particular sign and symptomatologies that the patient can be suffering from. The resulting complications, if the patient is left untreated, the complications that can occur in this particular patient of retinitis pigmentosa can be a macular atrophy. When we say it is a macular atrophy, we mean that the central vision is affected in these individuals, and that is the mainstay. The visual field effect would be most central in these individuals. So we have to encounter this macular atrophy as well. Then we must see the epiretinal membrane formation in a lot of individuals. We usually observe the cystoid macular edema in a variety of patients. And that is sometimes all of these collectively, the macular atrophy, the cystoid macular edema, or the epiretinal membrane formation. That is, there is a membrane that is covering the whole retina. So basically, the retina is affected, a membrane has come up, and the signaling factor that was responsible for the relaying of messages towards the visual cortex is hindered in these patients. So finally, the patient would encounter blindness. So we should know how to treat these cases of retinitis pigmentosa, how we can encounter. There is no specific cure for these for this particular blindness phenomena in these patients. But in a lot of cases, we can administer vitamin A in a lot of individuals. Then support groups are given. The lifestyle changes are advised for these individuals. The vitamin A dosages are usually almost 15,000 international units. And there can be then finally a gene therapy that is being promoted, and a lot of research work is being inculcated for this kind of a gene therapy in these individuals. So this is the final outcome. You should know that this particular disease can be treated through a gene mutation therapy that is being inculcated in a lot of countries. The diagnosis would be obviously based on the ophthalmological or on the fundoscopic findings of the individual. These would be the particular waxy appearances of the optic disc as seen over here. The mottled appearance is quite visible. The neovascularization is quite visible. So these would be the particular findings in this particular patient. The diagnosis can be also based on the electroretinograms. So these are sometimes performed. This is a control that is given over here, and that is usually compared with the patient's right, and this is the patient's left eye. So usually it is a bilateral condition in a lot of patients. And when we compare these amplitudes over here with this normal amplitudes, they are quite lessened. So this is the most important finding of the electroretinogram, which is abbreviated as ERGs, that is performed in these cases of suspected retinitis pigmentosa. This is the diagnostic test that is performed for the retinitis pigmentosa. Then moving on to another variety of retinal inflammatory disorders. It's another group of retinal inflammatory disorders that is affecting the vessels, particularly over here. So the range of disorders that can be present, it can be the Eales disease is one of the variety over here. When we suggest these kind of disorders, or when we are suspecting these kind of disorders, we're going to look for any pathologies of the vessels over here. There is a range of causative factors for the development of these vascular disorders. Autoimmune disorders are on the top of the list, which can cause the inflammatory conditions in this particular individual. As you can see, we're going to focus on the vessels. They are constricted, either they are accentuated, the cadral tracking phenomena, or any other signs of atherosclerosis that are indicative of any diseases that are involving the vessels of the individual. When we are comparing the pathology, one should know how a normal fundus of a normal eye looks like. So one should know how the normal vasculature is of the retina, and then only you can compare this vasculature or you can find out the abnormalities in the individual. We have the different range of varieties over here, ranging from the in a lot of patients, the veins are involved, and that is basically known as the periphlebitis in these individuals. And usually you're going to focus on these facts that neovascularization is a phenomena that is quite common in these patients who are suffering from retinal vasculitis over here, specifically periphlebitis. The thinning of the vessels is noted down over here, and the darkening or the necrotic factors, the gangrenous phenomena that is noted down in the retina. These will be the particular findings of the periphlebitis. In another variety for the retinal vasculitis is the periarteritis, in which particularly the arterioles are involved over here. So that would particularly look like this, in which we have the accentuated arteries of the retina that is quite visible over here in this fundoscopic findings, and we're going to see that the vessels are quite accentuated over here. Sometimes we can observe the vitreous hemorrhages that are associated with this kind of the inflammation of the arteries or the inflammation of the venules, and that is going to furthermore result in the signs and symptomatologies of the floaters phenomena that is reported by the patient. The patient would have the visual field defects which are quite movable. So whenever you're going to perform Amsler grid visual field detection of any defects in these individuals, the patient would give you a variation of the blind spots in the visual field. So there will be the floaters that he's going to observe. Photophobia, photopsia, these are the particular findings, and there is obviously going to be a decreased vision. That is the main complaint of the individual who is suffering from retinal vasculitis over here. And then finally, we have the angiitis. Angiitis is, again, it is detected or it is diagnosed by the fluorescein fundus angiography in a lot of patients. So whenever you're detecting angiitis in these patients, this is a picture of the fluorescein fundus angiography over here. As you can see, it's a phenomena in which you can observe if there is any cadral tracking phenomena, if there is any obstruction of the vessels in this particular patient. So the retinal vasculitis has its stages. I would like to emphasize the different staged factors of the retinal vasculitis over here, ranging from the acute retinal vasculitis that is leading to ischemia in a particular zone. And this ischemia is going to lead towards the neovascularization. So you have to remember this factor that ischemia is a signal for neovascularization. Ischemia is obviously the hindered blood flow towards a particular region of the retina, and that is going to signal the factor that there has to be a neovascularization, and abnormal vascularization factors are going to be activated, and that is going to result in the neovascularization in the retina. And then finally, the advanced stages of the renal vasculitis that would be encompassed by the complications of the renal vasculitis. Mainly, the complications of renal vasculitis would be the rubeosis iritis, which is a terminology used when you have the neovascularization occurring at the iris, that is known as the rubeosis iritis. The patient can suffer from retinal detachments. So these are some of the complications that can occur in the advanced stages of the renal vasculitis. The treatment that is involving the angiitis or the retinal vasculitis, that would include the corticosteroids, and then we can administer methotrexate or rituximab. So these are some of the anti-cancerous drugs that are manipulated to treat these cases of angiitis in a lot of patients. Obviously, a lot of research work is being carried out just to see the prognostic factors that are related to these treatment guidelines, but the outcomes that is going to be related to the preliminary condition of the patient. If the patient is not suffering from the advanced stages of the disease, then the prognosis would be quite better in these particular patients. Moving on to the symptoms that are particular for the retinal vasculitis, we can summarize the symptoms to be the gradual loss of vision that the patient will be reporting to. Obviously, the loss of vision would be subacute, or it can also be chronic. When we say subacute, the loss of vision would encompass to be taking place over a time span of 2 to 3 weeks, and if it's more than that, then that is basically regarded to as the chronic loss of vision in these patients. Then the red-green or the color differentiation, the reduced color vision or color differentiation that is observed in these individuals is quite phenomenal. Why does this happen? Obviously, the rods and the cones are being affected, the neurosensory pigmentary layer is being affected, and the vascularization that is promoting the blood flow towards this pigmentary layer, that is being affected. So obviously, the colored vision is finally going to be affected in these individuals. And then we have the photopsia. So photopsia are, again, that can be regarded as the signs of the floaters that the patient is going to be looking for in the visual field. So these floaters are quite peculiar in these individuals, and they are suggestive of the fact that the patient is suffering from some sort of vasculitis. Then we have central or paracentral scotometas. There is a visual field effect that can be central, as seen in this or as emphasized in this diagram. This is how the patient who is suffering from the retinal vasculitis would look at this particular picture. Then we have the signs that as a physician or as an ophthalmologist, what are the signs that you're going to look for in these patients? The RAPD is quite prominent in patients of multiple sclerosis. Then we have the visual field effects. The scotometas are going to be central, as we've already focused on this fact, even paracentral in a lot of cases. Abnormal Amsler grid. Amsler grid is the charting which is used for the visual field defects. So charting any defects in the visual field effect by using the Amsler grid and any abnormalities in this charting can indicate that the patient is suffering from renal vasculitis. Then we have the color vision defects that the patient can be suffering from. We can use Ishihara's charts or the Hirschberg's tests for this particular testing phenomenon. Then the elevated intraocular pressure, obviously all of these conditions of the vasculitis can result in glaucoma in these individuals. That is, the intraocular pressure can be raised in these individuals due to the rubeosis iritis that was caused. Now, what is happening after there is a new vascularization at the iris? The angles are closed, and that is how there was a flow towards the vitreous humor. And if once these angles are closed, the canals of Sclems are closed, the intraocular pressure would be raised in the posterior chamber. Specifically, this raised intraocular pressure is suggestive of ocular toxoplasmosis, which is one of the conditions, one of the infectious conditions that can result in the retinal vasculitis in individuals. And then finally, we have the anterior chamber cells and flares in these individuals. We have the neovascularization, that is, the new vessels are being formed after the signaling by the ischemia. So this is some of the factors. And then we have the varieties, that is, the variegations are noted down. Vitreous hemorrhages are indicative of the floaters that are being present as the signs and symptomatologies of the retinal vasculitis. The pathogenesis of the retinal vasculitis, it can be a primary vasculitis, that is the idiopathic nature of the vasculitis in which there is no known cause towards this vasculitis or the causation of this vasculitis. And then finally, we have the infectious vasculitis. When we say the infectious vasculitis, the causes are known. It can be either bacterial in origin, viral in origin, it can be parasitic, toxoplasmosis can be one of the reasons, rickettsial, it can be parasitic. So all of these infectious causes are basically related to whenever we say that it is an infectious vasculitis in these individuals. And finally, we have another variety of vasculitis, which is known as the immune-mediated vasculitis. So a lot of patients who are suffering from autoimmune disorders such as SLE, that is the systemic lupus erythematosus. Then we have sarcoidosis, Behçet's syndrome. These are some of the autoimmune disorders that can ultimately result into the retinal vasculitis in these patients. So these are the pathogenetic factors or the causative factors towards the development of this condition of vasculitis in the retina of the individual. Another variety of retinal vasculitis is the Eales disease. So Eales disease is an idiopathic in origin. Again, there is no specific causative factor known for the development of Eales disease. It's congenital, it's hereditary, it's manifested between 20 to 30 years. That is the second or the third decade of life when it is manifested in these individuals. The causative factor or the pathogenesis behind the development of the Eales disease is the hypersensitivity towards the tubercular proteins. That is usually it is associated with the tuberculosis in the patients. Signs and symptoms that are related towards the Eales disease are the floaters, a decreased vision is usually suggestive of, or the diagnosis is usually of the Eales disease in these individuals. The stages that would obviously, first of all, encompass the active inflammation that would occur in these individuals. Causative factors can be any hypersensitivity reaction that is occurring or any specific reaction even. And then finally, there will be an ischemia that is reported in these individuals. And this ischemia or this vascular occlusion that is noted down on the fundus fluorescent angiography as shown over here, that would basically give rise towards the neovascularization or towards the complicated stages of this particular disease over here. As you can see, there is the stage of the retinal neovascularization. New vessels are being formed over here. And then we have the sequelae or the advanced stages of the disease in which we can encounter glaucoma, we can encounter neovascularization, or even the retinal detachment is sometimes seen in these complicated cases of the Eales disease. The symptoms of the Eales disease would relate to the decreased vision. So there is a decreased vision. The patient would give you a history of floaters that is being observed by the patient. And these are the major signs and symptoms that would give you, and a little investigation that would be encompassing the hereditary causes for the Eales disease that would lead to the final diagnosis of this particular condition over here. The treatment that is usually manifested in these patients of Eales disease are corticosteroids that would basically hamper down the autoimmune process or the hypersensitivity reaction if it is occurring to any tubercular proteins. And then finally, we have the anti-tubercle therapy that is inculcated for a lot of individuals. The treatment that is modulated for these patients of Eales disease, it can be the laser photocoagulation that is sometimes noted down to prevent the neovascularization in these patients, to prevent the ischemia that is produced due to the blockage of the vessels in these patients. These are the fundus fluorescence angiographies that are giving or that are suggestive of this Eales disease. And then we can also try on the vitreoretinal surgeries to open up the vessels and to hamper down the hypersensitivity reaction. And even we can perform these vitreoretinal surgeries if there are chances of any retinal detachment, or in a lot of cases, this retinal detachment has even occurred in these patients. Apart from this Eales disease, we have another varieties of idiopathic inflammatory conditions of the eye. One of the well-known conditions is the Coats disease. That is, again, we are going to note down the neovascularization in them, and all of these changes are basically suggestive of the inflammatory conditions of the eye. This is the retina. The retinal detachment is one of the complications that is treated by the vitreoretinal surgeries. This is a light source, and this is a vitrector. So this is basically a surgery that is performed for the retinal detachment, which is a complication of Eales disease. The Eales disease itself is not treated surgically, but its complications can be treated by the surgeries. The bleedings can be treated by the surgeries. So in this particular lecture, we summarize the inflammatory conditions of the retina. So particularly focusing the retina, we summarized if it is the nerve layer, that is, if the optic disc is involved, if the choroid plexus is involved, or if it is the vessels that are involved in the cases. What are the causative factors? And we discussed the signs and symptomatologies, the clinical features, the prognostic and the diagnostic factors for these particular illnesses. So that is the end of this lecture. Thank you for watching sqadia.com.